Before I begin today, I want to express my heartfelt condolences to our neighbors in Nova Scotia. This tragic, senseless act has left many families, friends, and loved ones mourning in an already difficult time. And I know you all share the sadness of this news. And over the weekend, it is hard to believe, and we always think that will never happen here. And my heart goes out to everyone touched by this unthinkable tragedy. I know this news hits extremely close to home for many islanders, and it's only amplified by the anxiety and stress we may be experiencing in this uncertain time. If you are feeling overwhelmed, there's help available, and please reach out to a friend or family member. And I know Marion will be speaking about supports that are available through Health P.E.I. as well. And remember, you are not alone. Around the world, over 2.4 million cases of COVID-19 and more than 165,000 deaths. And across Canada, there have been approximately 35,000 cases and close to 1,600 deaths. Our case fatality rate in the country is 4.4%. There are no additional positive cases for Prince Edward Island to announce today. We continue with a total of 26 cases and 23 remain recovered. A total of an additional 153 new negative tests have been performed since the release on Saturday. Our local testing capacity is an important aspect of our COVID-19 response in Prince Edward Island. It has been and will continue to be. And I want to thank Dr. Greg German, P.E.I.'s medical microbiologist, for all the work he has done and continues to do, ensuring we have the capacity right here in P.E.I. for testing. Dr. German has been a leader in the swift move from P.E.I. needing to rely on outside labs for testing, which we've talked about before, using the lab in Halifax and the National Microbiology Lab, to our own validated testing right here. And we are fortunate to have Dr. German and his wonderful team. Our testing follows national guidelines and is in line with the counterparts and the laboratories across the country. We have the machines and we have the testing kits which and processes validated. Localizing our testing has allowed us to process more tests and have faster turnaround times. Our testing helps to identify people with COVID-19 so we can quickly move to contact tracing and isolating any positive cases. And this will continue to be key as we move into talking about easing up our public health measures here in P.E.I. For several weeks, we've been testing any individuals who are experiencing symptoms related to COVID-19 regardless of travel history. And this is very important to make sure we can isolate our cases. We are also testing contacts of cases even up to 48 hours before someone develops symptoms if they have a case. We are testing people admitted to hospital with influenza-like illness or respiratory illness. We will be testing our temporary foreign workers during their period of self-isolation. We are testing admissions to long-term care facilities and healthcare workers also, of course, who have symptoms. And now we're in a really good position that we are talking about testing other populations. And that discussion will continue this week as we go forward, and wanting to keep a very have a good sense of what's going on in our population in terms of COVID-19. We are going to need to learn to live with COVID-19, and I said that last week, and I need to repeat it. There's not a switch, unfortunately, where things will quickly return to normal. There will need to be a balance as we go forward. How do we loosen restrictions and contain a virus without a vaccine available? And we are looking at all parts of our society and what we do and what we're trying to figure out what it will look like going forward. If we increase the contact between people too quickly, we could have a surge in COVID-19 and widespread community transmission. So, for example, how do we resume elective surgeries and keep people safe and enough critical care beds available if there's an increase in cases? How can we ease up restrictions and continue to protect the vulnerable groups, such as long-term care? How do businesses function and plan on reopening, trying to maintain physical distance and continue to operate? How do we really look at our public health measures and not only improve our business and our healthcare system functions, but the social ones as well, and the social connections? How can we have more contact with people to socialize as human beings and do so safely? And we are missing each other. Our children miss their friends. We are missing our families and each other and our friends. So there's going to be certain parameters in place. There needs to be, of course, the testing. It will be too early to relax our physical distancing measures. But we are having these conversations, and I think over the next week you will hear more details of what this could look like here for Prince Edward Island. But we need to be patient. We need to move forward deliberately, thoughtfully, carefully, and gradually. This will mean that we will move forward in phases and in intervals, likely in 2-week intervals. And each of us will have a role to play as we move forward. Because until we have a vaccine, for instance, any case of COVID-19 could pose a threat, especially for vulnerable groups in P.E.I. It is a dynamic disease, and we learn more as time goes on, but we do know it's contagious and easily spread. So that's why we need to continue doing a lot of what we're doing, but we need to talk about what the next phases look like so that it will look different by the summer. We do have, we're in a fortunate position in P.E.I. in that we can also look at what they've learned across the country and the effects it's had on its population. And we've also been fortunate that we've had so few cases relatively speaking here in Prince Edward Island. Thank you. Avant tout, je voudrais offrir mes condoléances aux gens de la Nouvelle-Écosse. Comme tout le monde qui a entendu les nouvelles, j'étais choquée. Cet acte de violence gratuit, cette tragédie touche la vie de plusieurs personnes et durant une période déjà très difficile. Je sais que plusieurs personnes se couchent sans jamais s'entendre à ce genre de nouvelles le matin. On dit souvent que ça n'arrivera jamais ici. Mes pensées sont avec tout le monde qui est touché par cette tragédie. Et je sais que ces nouvelles touchent la vie de plusieurs insulaires et sans doute, ça amplifie les sentiments d'anxiété et de stress que certains de vous ressentez déjà. L'important, c'est que vous n'avez pas besoin de passer à travers tout ça toute seule. Et il y a des soutiens pour tout le monde et Marion va en parler plus de soutien de santé mentale. À travers le monde, on a dépassé 2,4 millions de cas de COVID-19 et plus de 165 000 morts. Au Canada, plus de 34 000 cas, à peu près 35 000 cas, et presque 1 600 morts. La bonne nouvelle aujourd'hui, c'est qu'il n'y a pas de cas à l'île. On a reçu 153 tests négatifs au cours de la fin de semaine. Il y a toujours juste les 26 cas et 23 des cas sont rétablis. Nos capacités internes pour les tests jouent un rôle important à nos efforts d'intervention pour la pandémie de COVID-19. Je tiens à remercier le Dr. German, le médecin microbiologiste provincial, pour tout le travail qu'il continue de faire et les améliorations qu'il avance pour nos capacités provinciales des tests de dépistage. On est bien chanceux que lui et son équipe travaillent si fort à renforcer et à augmenter nos capacités Grâce à ces efforts, on se trouve dans une bonne position pour faire notre propre test ici à l'île du Prince-Édouard. La capacité provinciale fait en sorte que nous pouvons tester de plus en plus rapidement. Et ça me permet donc de faire les suivis rapides avec les gens atteints avec le COVID-19 pour minimiser les impacts. C'est une des actions qui nous aide à réduire la transmission de COVID-19. Tant que nous n'avons pas de vaccin, le COVID-19 est une menace sérieuse encore pour la province. On apprend de nouvelles choses à propos de ce virus tous les jours. N'oubliez pas que c'est très contagieux et que c'est facile à transmettre. C'est pourquoi on doit continuer à faire ce que vous faites présentement, mais en même temps, on pense et on fait des plans pour relâcher un peu les mesures. Mais on n'est pas encore sorti de l'auberge et il faut relaxer ces mesures tranquillement avec des limites de temps à peu près peut-être chaque 2 semaines. On est chanceux ici, on a eu la chance d'apprendre des autres parties du pays et d'autres parties du monde qui ont été plus touchées par COVID-19. Ça nous aide beaucoup dans notre planification et ça contribue aux décisions que nous prenons pour la santé et sécurité des insulaires. Continuons à faire ce que nous devons faire ensemble, mais pas ensemble physiquement. Si vous présentez les symptômes de COVID-19, communiquez avec votre médecin, votre infirmière praticienne ou appelez le 811. Merci. Over to you, Marion.
Thank you, and good afternoon, everyone. I also want to first offer my heartfelt sympathies to all those impacted by the tragedy in Nova Scotia this past weekend, in particular to the members of the RCMP, first responders, and healthcare providers involved in that emergency. Thank you for your service and your sacrifice. We share in your sadness today as you deal with these difficult times. And these are difficult times for everyone. On P.E.I, I would want you to know that there is support for those going through difficulties and needing to speak to a professional to get access to resources. All of our families and individuals are adjusting to very difficult and different situations of living and socializing and trying to be able to support one another. My own family's made changes that are challenging for us and our children as well. And as Dr. Morrison said, we miss one another, and it's very different to go out and buy groceries now when you're social distancing and physically distancing from what is normally a very tight-knit and friendly community. I want to remind people that I've mentioned previously that our psychiatric urgent care clinic has been established at Hillsborough Hospital and is open 7 days a week in Charlottetown, where people seeking urgent care can be seen. The clinic is open from 9 a.m. to 7 p.m., and a Summerside Psychiatric Urgent Care Clinic will be open in the coming days. Call-in clinics are also available for mental health and addiction services, and programming has been developed in communities across the province to replace the walk-in clinics that have previously been available. No appointment or referral is necessary, and Islanders in need are able to speak to registered healthcare workers specialized in mental health and addictions who can offer support and, if needed, refer callers to other services that they may need for help. Health P.E.I. is working in partnership with other community organizations, and supports are available through those organizations as well, and they include Family Services P.E.I., the Canadian Mental Health Association on P.E.I., and the P.E.I. Family Violence Prevention Services. All of this information is available on the provincial government COVID-19 response website, and I know it's down in front of you, but it's the www.princeedwardisland.ca/COVID-19, and look for the section called Mental Health Supports. You can also access Health P.E.I. supports by calling the provincial government number, and that's in front of me as well, the 1-833-533-9333. And as of tomorrow, there will be a special line attached to this number where you can seek access to mental health and addiction services specifically as well. To our health PEI and government essential service workers, please remember that the employee assistance programs are available for you during this time as well. And as always, anyone who is experiencing an emergency health issue of any kind should call 911, and our services are available. Dr. Morrison spoke about our updates on testing, and that continues to be an important focus for our joint response team and our work to contain the spread of the virus. Using our local testing through our labs on PEI, we're getting access to results more quickly, and we have the availability for more testing. We continue to offer the cough and fever clinics and drive-through testing clinics in Charlottetown and Summerside 7 days a week. And appointments to those clinics are through referral from your family doctor or nurse practitioner or through 811. I want to thank all Islanders who are helping in this response, whether it's by social distancing, providing essential services, or staying at home when you can. We have all been making a difference, and just like to remind us all to be kind and support one another in these days, and we can look forward to how things may change and some of our services may be more available or the restrictions eased. But we need to do it carefully and thoughtfully, as Dr. Morrison will lead us through that, so that we don't overwhelm our system and that we can prevent deaths on PEI. Thank you.
Thank you, Marion, and we'll open for questions.
Brian Higgins, CBC.
Yes, good afternoon, Dr. Morrison. You mentioned that local testing will be extended to other populations on PEI down the road. Can you tell us more about what groups of people those other populations might be?
Well, we're certainly in discussions and feel fortunate we're in a position that we have the capacity to have those discussions. I think I listed a number of the groups that we already test and would test, but it would include if, for instance, there was a case in long-term care, testing other residents and staff, of course. We're also in discussions about what kind of testing we may be able to do for healthcare providers who move between facilities, especially in terms of long-term care. We're looking at the numbers and what testing could look like, for instance, for some of our essential workers who may be coming in and out of the province, and recognizing that testing people as they come off the bridge isn't going to be of much use just at that point in time, but it's to make sure that they're tested so many days later, and of course self-isolation being an important part of that. So, and I think I've spoken about it before, Brian, about the fact that certain tests, or if we do tests and they're negative, there's a certain percentage that means that it may be a false negative, and so we have to be careful as we go forward. So some of it would be repeated testing. So we're really in the discussion with the lab, our epidemiologist, our public health team, and trying to look at those numbers and how important that will be, because we need to be able to continue to tell know what's going on here in Prince Edward Island in terms of COVID-19 as we go forward in the weeks and months ahead, and be able to quickly detect cases, isolate them, do contact tracing, really key in any kind of easing up discussions as we go forward. So we'll talk more about that in the days ahead too.
Okay, thank you. And a follow-up question. You said in the next phase going forward, it will look different in the summer. Can you sort of tell us how you'll prioritize, what restrictions might be lifted, and what criteria you'll need to see before certain segments of the community are eased up?
So, Brian, we're exactly having that kind of discussion. Certainly, we're having discussions across the country, recognizing that different provinces are going to have slightly different timelines based on what's going on in their provinces. But it is something that we will be taking to the rest of government this week. As we indicate, there's well laid out, certainly criteria and then indicators as we go forward and thresholds for all parts of our society. So we'll hear definitely more in the days ahead, and very important discussions. And I know we're all anxious to know more details of what that would look like, and really moving into a risk assessment approach, and where we've been really focused on essential and non-essential. What does that look like from a risk-based approach, and trying to keep everyone safe as long as possible, but recognizing we have to live with the threat of COVID-19. And one of our risks certainly being importation. So it will be laid out in terms of time, in terms of phases, and risk mitigation going forward. So we'll all be having more details available in the days ahead.
Thank you.
You're welcome.
Louise Martin, CPC.
Hi, good afternoon. Dr. Morrison, over the weekend, BC Provincial Health Officer Dr. Bonnie Henry said that due to the pandemic, large events, so things like weddings, organized parades, would have to be canceled this summer in order to stem the spread of COVID. And I know the numbers are different in BC compared to Prince Edward Island, but I was wondering if that is something you anticipate will be the case here.
Well, and I have been contacted by a number of people who are planning to get married this summer with that same question, Louise. So, I mean, I agree with Dr. Henry in that mass gatherings, large gatherings, will certainly not be the thing that we would want to ease up in terms of restrictions early. And so I think it may be early for us to talk about the whole summer in terms of mass gatherings, but I agree that they will not be in the first phase. In the next few weeks, restrictions on mass gatherings would not be anticipated to be lifted as part of this early phase for us. And as you point out, BC is in a different position, widespread community transmission for some parts of BC, not for all. And their numbers certainly a little different than ours. And so we will have some of those really tough conversations because those impact a lot of things here in the summer, of course, not just weddings.
Thank you. My second question, you guys can decide who wants to answer this because I'm not sure who to direct it to, either yourself or Marion Dowling. But we know that many healthcare workers were redeployed and shifted to prepare for COVID-19 hospitalization. So, since we have had no hospitalizations to date, could we see some non-essential medical services return?
Hi, Louise. I'll answer that. Yes, I think you can see that starting to happen. And right now, our hospital-based services in particular are looking at planning for that. But it also has to be done carefully because our community-based teams are the ones who are fully functioning and working in our cough and fever clinics and our testing and assessment sites, and our home care staff have been taken on additional caseload for clients who live in our communities who may otherwise be in long-term care and are providing additional support. So we have to consider the whole flow of the patient through some of those more elective procedures or the semi-urgent type of interventions that maybe start happening. And we'll be doing that carefully within our systems capacity, because although the procedure may be done within a hospital setting, often the preparation may happen in the community settings and follow up within our primary care, home care settings as well. So we have to make sure we all have capacity to manage that workload as it moves forward. But we certainly recognize that we have delayed a number of things for individuals to create that capacity. We have moved staff around, and we're right now looking at making that same capacity available within our long-term care homes to make sure we're prepared if there were to be a positive case within any of our facilities and homes, and having teams of staff available to support those residents in long-term care as well, so that we can guarantee the quality and level of staffing that those residents deserve. So, long answer to your question, but yes, I guess is the short answer. You will see some of that coming, and we are planning for that now.
All right. Thank you so much. Appreciate your time.
You're welcome.
Stu Neatby, The Guardian.
Hi, good afternoon to you both. I guess first question to Dr. Morrison. We've talked a little bit in these briefings about how within public health there's some talk about more expanded testing within long-term care facilities, including residents and staff. I'm wondering if you can talk a little bit more about what the pros and cons of that is. Like what would limit public health right now from doing more aggressive and repeated testing of long-term residents or staff right now?
I'm not sure if there would be any restrictions at this time. I mean, long-term care guidance around testing was distributed out to private and public long-term care facilities last week, talking about just even some details around the process. If there's a patient identified, how to start with, 50 swabs would be immediately sent, and then the process of testing residents and staff, and that would be done on a rapid test, meaning they would be done within 50 minutes of getting to the lab. So that would be, for instance, one aspect of the testing. So I don't think there's really any restrictions from that point of view in place. And again, you're always weighing what we know is going on in the community, and I think I mentioned earlier as well, Stu, looking at and of course the testing of residents coming into facilities, not just on admission, but repeating that testing, and that guidance has gone out, and of course also looking at healthcare worker testing in between facilities, and really trying to make sure we just identify those healthcare workers and having that discussion. So I actually think we're doing quite a few things that we're in a really fortunate position to be able to do.
Okay, and I guess just to follow up for Ms. Dowling on kind of the same subject, do we know if there's adequate personal protective equipment for staff at long-term care homes, both private and public, and P.E.I.? I mean, is that something that's needed right now, or do we kind of know what capacity we have to provide that kind of equipment?
Yeah, hi. We have started supplying that equipment for all staff going into long-term care homes. I think I spoke about that last week as another preventative measure, or a bit of protection for the residents living in long-term care homes. And right now we do have supply to maintain that status for the masks and supplies that they need for protecting the residents if there are staff going in and out of the homes, because of course we have no visitation unless on compassionate grounds. So those people coming in for compassionate reasons as well would be provided with masks and and any of our home care staff coming into a home or community paramedics coming into a home would also be using the PPE. So we do have the plan in place to move that out and have the supplies available to those homes.
Thank you.
Welcome.
Carrie Wynn McLeod, Ocean 100.
Carrie Wynn.
Carrie Wynn McLeod, Ocean 100.
Good afternoon, ladies. My first question is for Marion Dowling. I'm just looking for some clarification on what's the protocol for those areas that have the long-term care facilities, but maybe in combination with community care or independent living. Is everyone then there, has to be under the protocols for long-term care?
Hi, Carrie Wynn. There are differences between the community care and independent living homes than our long-term care nursing homes. And right now, the protocols are specific for long-term care homes, where we're talking about the personal protective equipment of the staff going into those homes. Because of the way those residences are set up, as well as the level of care that our staff have to be in and providing within close contact. It's not the same in a community care or an independent living facility situation as it is in our nursing care homes, our long-term care homes. So there are some differences there. And right now our focus is on the long-term care residences who, of course, receive almost all their basic care and activities of daily living require support from the staff and close contact with staff throughout their day.
Thank you. My next question is for Dr. Morrison. I'm just looking for some clarification as well on testing and self-isolation. It's my understanding that when people are tested, then they have to self-isolate for 14 days. Following that, what happens then if the results come back negative? Then, just a couple of days later, do they just then stop the self-isolation?
Hi, Carrie Wynn. So there'll be sort of a multiple parts to this answer, I think. The first, if you're a returning traveler who is supposed to self-isolate from international or out of province, and you get symptoms during that period of time, and you, let's say on day 4, you get tested and you are negative results, you would need to continue to self-isolate in case you develop other symptoms related to COVID during that 14-day period. Now, for instance, though, if someone who has no outside travel, they're not self-isolating, they're just have been on P.E.I, no travel history, and they develop a sore throat, for instance, cough, and they go get tested. They self-isolate until the test comes back, so in this case, a day or so, and if that test is negative, they do not need to continue to self-isolate. So it's a little different for those two particular groups at this point in time. Based on our EPI here, we've certainly done well over 2,000 cases, closer to 2,200 cases of people who have not had symptoms, or who've had symptoms, many of those who've had symptoms, but do not have COVID-19.
Thanks so much for clearing that up. Thanks.
You're welcome.
François-Pierre Dufault, Radio-Canada.
Bonjour, Dr. Morrison. On a des nouvelles encourageantes depuis quelques jours. Il n'y a pas de nouveaux cas qui se manifestent dans la province. On pense au déconfinement. Mais de l'autre côté, vous nous dites que ça va quand même prendre du temps pour qu'on soit en mesure de revenir à une vie normale. Pouvez-vous m'expliquer un peu quel genre de réflexion vous avez ces jours-ci par rapport au temps que ça va prendre, aux mesures qui vont être prises, qui vont être présentées dans les prochaines semaines?
Merci pour la question. Alors, on pense des mesures qui devraient être en place, l'équipement pour protéger les personnes qui travaillent au long-term care et à l'urgence et aux hôpitaux. Il faut avoir la capacité de faire les tests ici. Il faut avoir la capacité d'isoler, identifier et faire de trouver les contacts des cas. On doit avoir un contrôle des cas ici, et puis on a ça, mais on a aussi un risque d'importer les cas. Et alors, on pense aux mesures pour la communauté de la société, de tous les aspects de la société. Et on pense en faire dans des étapes de peut-être 2 semaines à la fois pour être certaine qu'on ne voit pas un grand nombre de cas tout à coup. Et alors, on parle de ça avec les autres provinces. Il y a même la direction des autres pays commence à marcher aux autres pays et comment ça n'a pas bien été dans quelques cas. Et alors, on apprend des autres et on parle entre les provinces et les territoires pour qu'on peut faire un peu relâchement des mesures, mais au même temps garder en sécurité les gens ici à l'île Prince-Édouard et minimiser le risque d'un grand nombre de cas de COVID-19 ici. Alors, on va avoir plus de détails dans les jours qui suivent et ça va être basé sur toutes sortes de risques et combien de personnes. Et j'espère annoncer qu'on va commencer à faire des choses aux hôpitaux, mais aussi dans la communauté. Alors, c'est dans toutes les mesures, mais on doit les faire tranquillement et avec sécurité. Est-ce que...
Oui, vous l'avez mentionné aussi en anglais. Qu'est-ce que ça veut dire pour les rassemblements pour la saison estivale? On sait que c'est le temps des festivals, c'est le temps des fêtes de famille. Qu'est-ce que ça peut vouloir dire pour ce genre de rassemblement-là?
Je ne pense pas que les grands rassemblements de grands nombres vont être les premières. Je sais que pour certaines, ils ne vont pas être les premières choses qu'on va changer parce qu'il y a beaucoup de risques associés avec les rassemblements de grands nombres. Alors, je pense que ça va être un peu plus loin, mais on va voir et on en parle. Mais ça va peut-être dépendre comment on fait dans les premières étapes. Et ça a l'air comme combien de cas dans les premières étapes. Et puis après ça, on peut en parler un peu plus. Mais ce serait pas les rassemblements ne seraient pas les premières choses qu'on va faire pour certains.
Merci.
Okay, merci.
Laurent Rigaud, La Voix acadienne.
Oui, bonjour, Dr Morrison. J'avais également une question sur la stratégie pour les semaines et les mois qui vont venir. J'ai vu que le gouvernement fédéral recommande maintenant de porter des masques dans les aéroports et dans les avions. Est-ce que la politique en ce qui concerne le port de masques va être adaptée justement pour permettre aux gens de sortir plus, ou est-ce que vous pensez qu'il faut mieux faire l'éloignement physique toujours?
Bonjour. Je pense que ça va être plutôt garder la distance physique. Ça serait important et je pense qu'on va avoir la distance physique pour un grand bout de temps. Et puis, à propos des masques, on voit que ça va être, je pense, inclus dans les directions et quand on parle des regarder les risques associés avec les activités différentes. Alors, on va en regarder pour donner un peu de direction à propos des masques dans les jours qui suivent.
Ok, et j'avais une deuxième question. Vous avez dit tout à l'heure qu'il fallait un vaccin, enfin, qu'il fallait attendre pour un vaccin contre la COVID-19. Aujourd'hui, il y a un vaccin contre la grippe qui est là tous les ans, mais il y a quand même des milliers de morts chaque année au Canada. Comment est-ce qu'on va pouvoir, même avec un vaccin, pouvoir vivre avec ce virus?
C'est une bonne question, Laurent. Alors, ça va un peu, même avec la grippe, comme vous dites, le vaccin n'est pas tout à fait parfait pour tout le monde, mais ça réduit le risque. Et j'espère que même avec COVID-19, ça va être un vaccin qui est même plus effectif que le vaccin contre la grippe et qu'on va aussi trouver les médecins qui vont aider à traiter le COVID-19. C'est pas seulement le vaccin. Et on attend aussi qu'on va développer un peu d'immunité dans la communauté aussi. Alors, c'est une bonne question et on apprend tellement à propos de COVID-19 dans les 2-3 mois et on va apprendre encore de plus en plus dans les mois qui suivent.
Merci.
Merci. For those who were wondering, in terms of translating the first couple of questions I had already addressed in English around mass gatherings and the easing up. Question about would any advice be given about cloth masks as we go forward, and that would be included as we go forward in terms of easing up and the advice around it. And finally, the question around the vaccine, and we talk about a vaccine, and even our vaccine for influenza is not 100%, and how come we're waiting for a vaccine? Well, the vaccine will reduce your chances of getting ill, just like our influenza vaccine. We hope that it is effective, and there's a lot of research and interest and momentum to try to develop and get a vaccine. But there's also work being done to develop therapeutics so that we can better treat COVID-19 in the year and years to come. So we've learned a lot in the last 3 months about COVID-19, and we'll continue to learn a lot about COVID-19 as we go forward. So thank you all.